Welcome back to Helen on Let's Talk Health. Today we will continue to learn about the diagnosis, treatments, and how your diet can affect osteoarthritis. And here's Dr. Choi again.
So when you do start to have pain, a lot of times we would go to the medical doctor or our healthcare professional just to have a look at what's causing the excess pain. A lot of times when we go to these doctors, they will take a medical history, asking us questions of how it happened, when it happened, what aggravates it, what alleviates the pain, asking about our lifestyle to see what can we do to help prevent the pain from being worse. Next, a physical examination is done just to see if we're losing range of motion in certain joints and also what structures are affected, whether it's muscles, ligaments, or just the joint itself. Now, if needed, an x-ray can be taken to see the severity of arthritis or just to double check if all the structures are intact and if there's any wear and tear in a specific joint. Now, if you look at the image here, okay, we have the structure of a knee. Now remember, an x-ray is only to see bone, okay? Although it's only calcium based, we can actually still help determine whether or not there is arthritis in the joint. If you look here, okay, at the top, we have the femur, which is our thigh bone. At the bottom is our tibia and our calf bone. Now remember, between two bones, we have the joint and cartilage. The cartilage is not made of calcium, so it does not appear on x-ray. However, it does appear translucent and actually hollow in between the bones itself. So on one side, you actually see a healthy joint. If the cartilage was starting to wear and tear and start to break down, that would actually start to thin out. And you'll notice on this other side, okay, that joint has decreased so much that the space has also minimized and we have a reduced joint space. If it is a reactive arthritis, you will see a darkening between the two bones, which is known as sclerosis. So there's inflammation and reaction of injury happening. But for example, if there's some bone on bone contact, okay, your body's trying to heal itself, bone spurs may form, also known as osteophyte. So that's why even with an x-ray imaging, we could see the severity of your arthritis. What are some of the treatment options that we can go through? First, of course, I would recommend chiropractic. Chiropractic is a profession that can help treat pain, okay, help you improve range of motion, and teach you different exercises to strengthen certain joints to help protect it. Whether it be your knees, your hips, your lower back, we can help. There's joint protection, depending on which joint is affected. Maybe you want to put a brace on it so that you don't use it as much, or even it's a good reminder to be careful when using that joint. Exercise is a good way to maintain flexibility, improve your range of motion, and also strengthen the muscles that protect the joints. Supplements is something that you could take normally over the counter. I personally recommend trying to take a lot of these nutrients just by the foods, but if needed, supplements can be an alternative to added nutrients too. And with these supplements, what you want to do is help to improve conditions of the components that make up the joint, or even help boost up your immune system to protect your body. You, of course, have pain medications that can be over the counter or prescribed by your family doctor. Certain treatments, for example, hot and cold treatment, okay, to help alleviate swelling, joint pain, and muscle tightness. Weight control, okay. As I said before, 1 pound of weight that you gain is actually almost 4 pounds of pressure on weight bearing joints. So if you were to lose 1 or 2 pounds, it can actually protect the joints too. Now, if all else that you've done has really not helped you, or if your arthritis has gone very bad or it's very severe, the alternative, of course, or last resort would be surgery. Surgery would be required, for example, if your quality of life is drastically diminished, range of motion is not there, and your joint cartilage is completely gone. You will get a replacement or a new joint. So earlier on, I mentioned alongside the supplements that I do believe having a healthy diet can help protect the joints or even just the body itself, because diet and nutrition has a significant impact on actually chronic pain and arthritic conditions. So most of the time, their studies have shown that you want to avoid a component called solanine, okay, SOLANINE. These are actually found in eggplant, peppers, tomatoes, and white potatoes, usually dark shade vegetables, because selenium actually can cause pain and increase discomfort in people with arthritic conditions. If that's so, just try to avoid these foods. However, you could balance it off with a lot of all the anti-inflammatory foods out there. So some examples include salmon, onions, blueberries, which is high in antioxidants, cranberries, also high in antioxidants, garlic, very good in anti-inflammation, brown rice versus white rice, avocados, which is good for the fatties, omega-3s, fresh pineapple, and papaya. So these are just some examples of anti-inflammatory foods. Okay, so this is just a general introduction to what osteoarthritis is. Every patient comes in, they do present with different problems, different signs and symptoms. Our goal is to help you improve your quality of life, maintain strength and exercise daily to improve your range of motion and also keeping healthy joints. Take care.
Thank you, Dr. Choi. But eggplant is one of my favorite vegetables. I'd better cut down on my consumption of eggplant just in case I can play the piano like Beethoven or paint like Picasso. You know I'm kidding, right? But I do like most of the other anti-inflammatory foods that Dr. Choi recommended. Did you learn something new today? I sure did. Thanks for watching, and remember to like and subscribe to my channel. Stay safe and stay healthy.